I graduated into the pandemic, which was super fun. Don't recommend. We found out that we were going to start working 3 months early from the news. At that point, I was very much considering leaving medicine completely. I sort of had a quarter-life crisis, went into acting, and then sort of came across aesthetics. Starting a business is, oh my God, so much harder than I think people think it is. Employment is a trap.
Today on The Patient is Always Right, we have Dr. Nabil Jetha on the sofa chatting about all things aesthetics. He talks about how he moved from NHS into aesthetics, but also had a little acting break in there as well. And we discuss how he actually graduated straight from university into the pandemic and how that actually shaped his career. So let's get to it. Hi, Dr. Nabil.
Hello.
Thank you for joining us on The Patient is Always Right. We're very excited to have you on today.
Excited to be here.
Good. Well, we're going to start, as always, with a quick fire round just to warm us up. So I want you to answer with your gut instinct answer.
I'm ready.
Right. So trend-led treatments or timeless techniques?
Timeless techniques.
Data or intuition?
Data, but intuition has its place.
Agreed. Unlimited funds with limited creativity or unlimited creativity with limited funds?
Say that 5 times very quickly.
I know, we really have to think about that.
Do the unlimited funds, can I keep it and then retire?
Yeah.
No, I'm joking. Unlimited creativity, limited funds, definitely.
Yeah. You'll make the funds.
Absolutely.
Absolutely. Go back in time and become an actor or stick where you are right now?
Oh, stick where I am right now. Yeah.
Nice. Well, we'll talk about the acting for anyone that is like, what? What's that? We'll get into that.
What is that all about?
Yeah. So obviously we want to know about you. So for those who don't know about you yet, tell us about yourself, a little bit about your history, and we'll obviously dive into everything else.
Yeah.
But yeah, give us the lowdown.
This is me. Like cue the, was it Greatest Showman? This is me. No. I am a medical doctor. So I have a Bachelor of Medicine, Bachelor of Surgery from UCL, and a BSc in Medical Sciences with Global Health. Side note, that was like my favorite year in medicine. And then, I graduated into the pandemic, which was super fun. Don't recommend. And then I sort of had a quarter-life crisis, went into acting, which we'll talk about, I'm sure. And then sort of came across aesthetics, loved it, got my master's level diploma in it within the year that I started. And haven't looked back.
Amazing. So obviously you touched on lockdown and COVID and all of that. So what was it like graduating during that time? I mean, it must have been wild.
Yeah, I won't beat around the bush. It was tough. It was really, really tough. I mean, literally finished finals and we walked out and we turned our phones on, like about to go out and celebrate. And it was like lockdown starts at midnight.
Oh my gosh.
On the day. And I was like, great, thanks, Bojo. We waited one day. And so that was tough. And then, it was like crazy things. Like we found out that we were going to start working 3 months early from the news. Like, I don't know, who was the health secretary back then? But anyway, it was just like on the news and I was watching it with my parents. I was like, what's that? It was like the new graduate doctors are going to start 3 months early and it's a new initiative. And I was like, is that me? I didn't get the memo. So we're supposed to go on our elective. It's supposed to be like 2 months. You go away with your friends, all of that. So that all got cancelled. And it was tough to go in. And as people know, like the NHS is poorly resourced. We didn't have great PPE to start. I mean, sort of just asked to go and risk our lives, to be fair. But I think I'm incredibly proud of myself, my colleagues, the NHS for getting through that period. I think never seen like teamwork like that. And it was amazing. And I am who I am from that time. It's one of the toughest times of my life. But it's tough, learned a lot, powered through. I don't think I'd be where I am in my life without that period.
Interesting.
I don't think I would have made the decisions I did.
So do you think,
that period.
Yeah, because I guess it was almost like trial by fire. You just had to go with it, right? Like it was almost, what a way to like start your medical career.
We're all figuring it out. And as doctors, you kind of have to be like, yeah, we know what we're doing. And I was like, do we?
Yeah.
What was tough as well, I think, because, there's lots of sickness and we're already understaffed, that, you were going in a lot more, you were staying later. So work was intense. And then when you come home, it was kind of more work because your friends, your family, they're all asking you about like COVID, like what's happening, what do we know,
Oh, God.
So it was all quite full on.
Yeah.
But yeah,
But do you think as
great
well,
times.
like obviously you said it kind of shaped where you are now. So like talk a bit about that. Like why do you think it's shaped where you are now?
Well, I never took a break. I never took my gap year. And then I didn't get my like I said, I didn't get my elective. So we kind of graduated, I think April the 1st or something. And then 26th of April, I think I started being a doctor. Yeah, I was supposed to start 1st of August. So I never took a break. So, school, uni, straight into medicine, no break. And so when I finished my first 2 years, I was like, I need a break. And that's when I was like, I want to pursue acting. It's something I wanted to, see if, I can do it, if I enjoy it, what it would be like. And that's why I was like, I'm going to drama school.
And you didn't go to just any old drama school. You went to...
I did go to LAMDA.
LAMDA?
Yeah, I did.
That is mad. Like that's
great.
So, I mean, I'm talking about myself and obviously feel free to cut this out, but context, I also went to theatre school. So when you're at
I didn't know this.
Yeah.
Oh my God.
Well, we can talk about that probably not on
another
camera.
time.
But when you go to theatre school, you want to come out and go to LAMDA or RADA, or if you're looking to act, if you're looking to sing, there's other places. But yeah, and so when I saw that, I was like, you went to LAMDA? Like that's like goals.
Yeah, it was great.
Yeah. So yeah, what obviously you said you always wanted to try acting. What was it like to actually do it?
Oh, I loved it. Yeah, I loved it. It was tough. I think a lot of my background was in comedy. So I really wanted to try and like get out of that. I loved it. I learned a lot. I met some amazing people, gained some amazing skills. It was fun, but it was time. Like I think I'd scratched the itch for that time. And I'm not saying never say never, but it felt like I'd fulfilled that part of my life that I really wanted to explore.
Yep.
And it was just really, really time when aesthetics started to kick off, and I was like, that's actually this. It just ticks so many of my boxes.
And do you think, obviously, you do use your acting skills because you are on camera for your own promotion of your own work? But do you think you use those skills like otherwise, like within work? Do you think like you learnt during your time at LAMDA?
Oh, absolutely. Yeah. Do you know what? This is funny. One of my med school interview questions was about how my acting, because I did a lot in school. I wrote plays, I directed things. So they would like, tell me, like, how do you think that would help? And I was like, that's a great question. But it does, it absolutely does. I mean, honestly, like being a doctor, it's a performance. It's unnatural how calm you have to stay, how professional you have to stay all the time. You can't just instinctively react to what people are saying. And people come in with all sorts of concerns, all sorts of problems, and they come in with different weights. Some will come in super anxious. Some will come in calm and confident, and they've got something seriously wrong. And you've got to stay calm. You see some random stuff. So adapting to that, acting has really, really taught me and trained me to, read body language, read the room, read the person, and adapt in the best way possible for them.
Nice. No, that makes sense. It actually makes a lot of sense as well. So I guess going back to the NHS, what was the moment when you realised that you were going to walk away from the NHS as such into aesthetics? Was there like a light bulb moment, like I'm not going back, or?
Well, it wasn't really, because I think I left the NHS to pursue acting. And then I did some work with the government in functional medicine. And then I came across this. I mean, I always had a thought about, like Botox, I might do a course one day, whatever. And then it got to a point where I was like, I do need sort of like a more flexible income. So I was like, let me do a Botox course. My friend recommended Interface Aesthetics, plug. And I just loved it. Like from that first course, I was like, this is everything. And don't get me wrong, like at that point, I was very much considering leaving medicine completely, which is a really hard decision for a doctor. Like you put so much time and effort into it. But I really was, and it just reignited my passion for treating people. It just combined like the fine motor skills that I was, wanted to pursue ophthalmology, talking about mainstream medicine. And I love those fine motor skills and microsurgical skills. It gave me that. It gave me interacting with patients, and it fulfilled something which I was really trying to find how I would do this, which is improving people's quality of life, not just prolonging years and doing a 15, 20-minute filler treatment, and you get that reaction of showing them the mirror. I'd never seen that before. You don't get that in any real other part of medicine. And I remember vividly that patient on my training course and that look after I did that filler treatment, and I was like, that was me.
Yeah.
That was amazing.
No, I love that. And that makes
What's
a lot
the
of
question?
sense. You answered the question perfectly. Like that, I mean, yeah, it's so interesting because I think a lot of people don't talk about aesthetics like that, like the way you talk about it. Like actually, it's not just prolonging years, it's quality of life. Because I do think that's such a big thing that aesthetics does. It gives people back their confidence. It really can change lives.
Yeah.
And I think a lot of people who are in it probably forget that because you're so like in the weeds. But from an outsider looking in, I'm like, it can be life-changing for people.
Absolutely. And it's not just superficial and anecdotal. Like there are studies out there that your appearance matters. It's why we wear makeup. It's why we dress the way we do. It's to make us feel good and feel confident. And that shows and that goes forward, and people have more success in life from it.
Absolutely.
Yeah, it's not just the superficial thing. I think people, and the stigma that the industry does get.
Yeah, fair enough. So going back to the NHS for a little bit, because I'm going to dip back in and out. Did anyone ever suggest that when you moved into aesthetics that you were wasting your training? Does anyone ever use that kind of language?
Behind my back. Do you know what? No.
Good.
I clearly have great friends and family. Or again, they're saying it behind my back. No, I think because I think a lot before I make decisions, and I may have jumped around with like what I want to do, but because I think a lot about what I want to do, and people knew that this was now my passion. I wanted to find something that I can do, that I can give back and feel fulfilled with. And when I found it in this, and I spoke about it, and also like educated people that aesthetics isn't just Botox and fillers anymore. There's so much more that you can do with it, and the nuance of it. No, they fully supported it. And I think the industry is super unregulated in the UK as well. There's so many complications that are happening. I think people got that, to put my medical skills, my knowledge, the ethical background that I have and know from like medicine and how to practice safely and ethically, putting that all into this industry. I think people were like, yeah, go for it. Great.
Yeah, makes sense. And like on that, do you feel like there's a shift in patients wanting to go to medical professionals now rather than non-medical professionals? Are you seeing that at all, or do you think it's still...
Yeah. I've seen it from the get-go. And as things progress, as government proposals come out, educating people that it's unregulated and we need to set standards. And it's been a bit slow. Instant is quite slow, but we're getting there. I get patients like, oh, you're a doctor, like an actual doctor. And I'm like, yes.
I love that, actual doctor.
Yeah, all the time. No, definitely. And I think that's great because it shows that patient education, that public education we're trying to put out there, that you need to question people and what they're... And I love it when people say you're an actual doctor. I'm like, yes. Because good, question people. Like, this is your face or other parts of your body. Like, these complications could be lifelong, really. So question people on their qualifications, their training, their experience. Definitely. I love it when people do it.
Good. And yeah, I mean, training wise, you've done a lot, and obviously you now also are part of, is it interface aesthetics, where you're like part of that as well, which is really interesting. Mentoring. Did you know that you wanted to always mentor? Was it just like a natural transition?
I mean, medicine, it's a lot of it is teaching. You're educating patients, educating your like people who are junior to you. You teach all the time, and you're learning all the time. So it's almost part of it. And aesthetics being, a medical specialty, it's natural for there to be it to be a part of it. I didn't really think I enjoy teaching, but I didn't really. I was like, I wasn't like this would be a big part of my, career. But I'm really enjoying it. I'm really, really loving it.
Nice.
It's fun.
I bet.
It's super fun.
And I think even from a patient's perspective, if you're training, it almost gives you that extra kudos as well. Like, okay, if he's training people, he must be really
He must
good.
know. He's really good at faking it.
I think like psychologically they wouldn't even subconsciously they probably wouldn't even realize they are thinking that, but you would. I think
so.
If you see that on someone's like profile, you'd be like, oh, a trainer is okay.
Yeah, definitely. Well, you need to know your stuff. But do you know what? That's what also, it's not fully altruistic, the mentoring, because I learned so much. But you have to be super knowledgeable and you have to know everything, because people will ask you then so many things. So I learn so much by mentoring, and teaching. So yeah, love it.
No, makes sense. Cool. So yes, going back to your acting now. Did you ever think, like, once you'd kind of done your training in acting, that you were going to pursue it as a career? Or did you know once you'd kind of done that it was almost like just scratching the itch?
No, I went into it wanting to go into that as a career. And I got an agent. I was auditioning for things. It was just time. I think I wasn't 18 anymore and could like safe as surf and like working about. Like I had a career and I was still practicing medicine during that period, and the flexibility wasn't there to like, okay, you've got this audition, means like not turn up to work next week and do that. Like it just practically wasn't happening. And I was like, and actually, do I want to? It really was like, it was lifestyles. Like, do I want that lifestyle? To like give everything up for a commercial, which isn't really what I want to do, and hope that comes to something. Like it was a lot of risk, and I sort of established myself and my life, and it was kind of like, do I want to give that up? And I was like, no, not right now.
It's hard, like,
and never say never.
Yeah,
but at that point, I was like, no, and I think aesthetics had entered my life at that point as well, and I was just like, I think that's what I want to do.
Did you know with aesthetics? Did you always know you wanted to work for yourself, or did that also come later?
It came later. I think there was always a part of me that was like, oh, I could be good as a business person. I always thought that, but it came later. It was good to work for other clinics and learn and build up my skills and practice. So it only came later that I was like, actually, I think I'd be good at running this.
Because it's interesting. I find that with aesthetics, you've got two kind of paths that people take. A lot of people, when I say people, doctors or nurses, I would say more so, when they go into it, they go into aesthetics wanting to work for themselves because it will be an easier life than what they're doing on an NHS ward or, in the GP surgery. I hear that quite a lot. Or you've got the ones that are complete accidental business owners.
Yeah.
Where would you put yourself? Were you somewhere in the middle?
Somewhere in the middle. I think just circumstance led to me doing it at the time I did it. It's a little bit of a trap. I'm not gonna lie. That whole employment is a trap. Side note, but starting a business is, oh my god, so much harder than I think people think it is. And so that's something I say to people who are doing courses. Think if you actually want to be a business owner or if you want to be an aesthetics practitioner, because they're very different things. It sounds great to it's mine, but then it's yours. It's your baby. Every part of it, things you wouldn't even have thought that would be part of this business, is going to be part of your life, and you have to learn so many different skills. So yeah.
And do you know what? I think this is one of the things that we always find within Ignite, because the natural thing for a doctor or a nurse is not to sell. No. Right? And when I'm not saying that you are a salesperson now, but you're selling a service, right? You're having to close a sale because they might go to a competitor or they're someone who, I don't know, is choosing between different treatments and they would do really well with a treatment plan, but that's going to cost more. Like, you have to start talking about money, whereas before you probably didn't have to speak about money, I would imagine. Was that alien? Yeah,
and this is why I feel like dentists are so great at this, because in our training here, as I can speak to for doctors, but I think nurses as well, when I speak to them, it's like we would, our whole outlook was to work in the NHS and be in a public sector and be employed forever. To shift to being in the private sector, to being self-employed, is so different. And then also you're not just educated. I mean, there's a given in the NHS that this is going to be free, so there's no part, you don't do that whole and now check out. that is difficult. It's difficult to put money into that conversation. It really impacts trust and outcomes, because, if people don't trust you that this is going to be the best, despite the price, that can really impact the overall outcome of the treatment.
Yeah.
It's difficult.
It's interesting difficult. You said about dental as well, because I feel like dentists get a bad rap for talking about money, but actually they are talking about something that is going to impact someone's life, and it's going to, again, it's trust. Like, that's a big thing that we always find. Like, if you don't build trust when you talk about money, of course that sale's not going to happen, because they need to trust you in order to invest in whatever that treatment is. And it's funny that you said that, because that's the bit that I think in dental they struggle with, the building trust, whereas I think doctors naturally are better at building trust, maybe because of the training. So it's like a catch-22 really, isn't it?
Yeah,
it's interesting.
It's definitely difficult. I'm still learning.
Yeah.
And how to best do it. But...
No, I know. And like with beauty in our course, because that's how I got into aesthetics, is through beauty. You learn how to sell on the course, which is really interesting.
I guess I don't really think about it as selling. I kind of just practice how I practice medicine. Like, these are the options.
Yeah.
These are what I think is best. It's your decision. It's your life. It's your body.
Yeah.
I'm not going to force anything for you, but I think this will be the best thing for what we've discussed.
Absolutely. Authenticity.
And then they'll ask about prices. I'm like, okay, well, that's the price. I'll just focus on education, and that's all I can really do, I feel. And it tends to work.
Yeah, no, absolutely. I think one of the things I loved, like, watching you and like when you're doing your consultations and having a consultation with you, is you are so detailed. Like, you really are like thorough in the information you give, which does help. Like, it does build trust.
Yeah.
A, it builds trust knowing that you know what you're doing, obviously, but B, that you are really talking to me personally and like my experience and what would be the best outcome for me, and not so much the treatment itself, if that makes sense. Zooming out to the bigger picture of like aesthetics, and really talking to like other practitioners, I think, because one of the things that people love, I would say, about this podcast is hearing the point of view of another practitioner, because when you're in it yourself, like, it's quite hard to zoom out, I would say. So what are the perceptions that patients are still getting wrong about aesthetics treatments? Like, what are some of the things you hear that are maybe misconceptions?
It's kind of the obvious ones, to be fair. It's the overfilled look that we've definitely shifted away from. And so people are kind of scared of filler. And I'm like, no. Like, filler does what it does, which is revolumize, okay? And we lose volume with age. So, bone, fat, laxicity from the skin. Like, filler is the only thing that can replace that volume, really. And so it definitely has its place if we want to go like a holistic approach. So people are so scared of it because they feel like they're going to be overdone. I'm like, well, if you think about it in the fact that you've lost this volume from that age or how you looked back then, so the only thing we can do is replace it to get back to that in terms of structure. They're like, oh, okay, fair. And it won't look overdone. We won't give you more volume than you ever had. Well, it depends who you get to. But that's not what I will do. But yeah, that is such a stigma, I think, that's still there. And I think it's just the overdone in terms of other things like Botox as well. Like completely frozen, can't move. Like, no, like, we're here to give you that natural, as much as possible look.
Yeah.
And work with you for that. If you want to be frozen, then, that's your choice. But
we had someone,
I think
literally...
those are the big stigmas. And then I think just men not thinking that they could benefit from treatments. Aesthetic treatments.
Go into more detail. That's interesting, because we don't really talk about men much. I don't think we've tapped into that topic. So yeah, it'd be interesting.
It's funny because before we talked about, like, society, like we it's on our looks, it's how we dress. Men are starting to get into that, like fashion, hair grooming, preventing hair loss, all that stuff. It's now coming into the face. Skincare, even makeup and stuff is coming into that male demographic. So thinking that aesthetics isn't for men is false. I think the latest stats is 14-15% of aesthetic treatment uptake is from men.
Wow.
And I think that's grown since I have been practicing, and it's growing. So that's a big one. I think people don't
No.
Yeah. And it tends to be friends being like, oh, but yeah, I had that, and being open about it.
Mm.
I'm like, oh, because you're like, oh, you look great. Like, what have you done? And it's like, oh, well, actually, I had that. And I was like, oh. Or even just skincare.
Yeah.
Just please.
I read somewhere actually though that men
Wash your face.
Yeah, that's like,
Not with a bar of soap.
yeah, don't dry out your skin, please. But I've read that somewhere that men, when they get into a routine, are so much better at sticking to it than women. Like once they're in it, they're like in it.
Yeah.
So yeah. But it's getting them to that
that's
point.
True. I think because also they haven't like done all these like loads of different treatments and like entered all these different pages saying this product. So when they come to you, they're like, okay, well, I'll come to you. I'm here for your advice. Like, I'll listen to what you say, and they stick with it.
Yeah.
I think because the barrier of them coming in is so much higher, so that once they have come in, they're like, well, I'm here.
They're more likely to go ahead, probably.
I'm going to listen to what you're saying. Like,
yeah, that's really interesting. That makes sense, actually. So we mentioned that you're a mentor for interface aesthetics. So what would you say is the number one thing that new practitioners underestimate when coming into aesthetics in general?
That it's a medical specialty. And with that, think about how you would treat it with every other specialty. So that means if you don't want this to be just a side hustle, and you want to be the best, which most medics do. You want to be the best at what you do. You want to provide the best treatments you can do, the best consultations, the best for your patient. That means training. That means time. And in the little private world that we live in, that also means money. Like, yes, you can do a 1-day course. Yes, you can do a 2-day course and be an advanced practitioner. I mean, you're not. You may have been trained in the advanced skills, but you need to refine those skills. And the best way to do that is more training. And we're really lucky because when I talk about my mentors and colleagues who have been in this industry for 20, 25 years, they didn't have this. This was like, you'd have a 1-day course and that was it. That was all that was on offer. And then you kind of go forth and prosper. We have mentoring schemes. We have the level 7 diploma now. If you really want to do this and you really want to be the best, invest in that training and the time and yes, the money that takes, but it will come back 50-fold because patients, you would have done a really, really good job and patients will know that and then they'll come back.
Yeah. And I guess the more people do these courses and the more patients see that, you've done that level 7 course, the more they expect it as well. Like over time, I guess people will be looking for practitioners that have completed those courses. Yeah. Like that will become
that's how we entered medicine. It's lifelong learning. You'll never know everything and you'll never stop training if you want to be the best that you can be. So treat it like that. It's not a 1-day course situation. I mean, do it if you're like not sure about it and you want to see what it's more about. Yeah. And then I think that foundation course is great because it will give you a flavor of it. And that's how I was like, this is great. I love it. I want more. I want to train more. And I don't stop training. Like constantly have a training course that I'm going on. Because it's so important and there's so much new stuff coming out.
I was going to say new treatments as well. You must like be doing courses for that all the time. Then
but you need to and the only way to figure out if it's BS or not is really to learn about it as much as you can. So
interesting. So have you actually done any courses where you're unsure about the treatment, but you thought I'm going to just go and do it and see what it's about? Have you done that before? Is it more like you do your research and then make the call if you're going to do a course?
Yeah, I mean, I've been thinking about device lasers. I like the newest trends. Lasers are the new thing, and don't get me wrong, like some lasers are great, but it's a minefield. And so I'm like, well, I'm not just going to buy something. I need to do my due diligence. So I have been doing a lot of reading and research and training and turning up to events and talking to people. So that's an area that I'm sort of seeing. Because the thing is, different lasers do different things. And so if I actually want to get into the field of lasers, I mean, how many devices am I going to... What do I actually want it for? So...
Yeah, lasers are, I think, like, it's really funny, actually. When someone gets into lasers, they are into lasers. I went to an aesthetic practitioner's, we were doing a shoot there. I won't say the name, but literally they had a room of just lasers. Like every manufacturer you can think of, every laser you can think of, and they knew exactly, but they layered it. It was really like nuanced. Like he literally was like the laser specialist, and I've never seen that before.
Yeah, what I think we're entering a time of aesthetic subspecialties, to be honest. And I think lasers is a huge one because, it's huge investment. money wise and
Absolutely.
time wise, like, and it's nuanced. It's not like, yeah, go for a laser treatment. Like, okay, but what are you trying to target? Different layers, ablative, non-ablative, like fractional, like all that. Like, there's a lot to think about. And if you want to be the best at it, you almost have to subspecialize in it. So yeah.
Yeah, it's interesting. It's like a whole world that I kind of unlocked. We worked with Cyton recently in one of their events. We went to their Skin CO event, and they were doing presentations about different methods and the way that they did it, different practitioners did it, which was really interesting. So obviously there's a particular way that works for them, and they wanted to share that with their colleagues. And it's just like, oh my goodness, it's like a whole thing. Like, you get trained one way, doesn't mean that's the way you're going to do it, because you're going to discover different ways that work for you. You're going to layer it, you're going to do this, you're going to do that. I was like, it's a whole thing I didn't even know existed. I thought you buy a laser, you do the laser and you go home. But
No.
Definitely not.
Yeah. And the whole buying a device thing in your clinic will flourish as a trap as well. So
absolutely,
no matter what people say,
that's the trap. Unfortunately, we see the most, I would say, at Ignite for ads. People come to us, they've spent hundreds of thousands on a device, and they're like, no one's coming in for treatment, and then they want you to fix that, and it's like, no, there's a lot that goes into it. It's a lot. And I think some device manufacturers are amazing with support, some aren't, and I think that's something that people need to look for. Like, it's not just the device, it's the aftercare, it's the support, all of that.
Definitely.
For sure. So what would you say is, I guess, on that, missing from education within aesthetics at the moment?
I think we're really good with clinical education and training. Like I said, I think we've come so far, and it's great. And there's so many opportunities to train more and more and more and get more and more proficient. I think we lack training in what we were talking about in terms of, this isn't a private field and you're going to be self-employed in this, and that it's a big change. I think we could be better in helping and educating mentees on that side of things, how to start, where to start, what you need to do, how to open a business account, how to, what's a good card machine, like what's a good business account, like, get good accountants, like so much, like there's so much you have to think about and it never ends, like, oh, do you want to get a website? You need to get a booking link. What platform are you going to use? What's good? There are so many out there.
It's mindful.
Do you want to be a sole trader? Do you want to start a company? Like, pros and cons of both. It's a bit of a minefield. I think we can do a lot better because it's part of it.
Yeah.
Huge part of it.
Yeah.
Is the business side.
And you mentioned dental. They have a whole module just on the business side. Because I guess with dental, you're more than likely going to do private and NHS, right?
Yeah.
When you
fully
start.
Private.
Or fully private, exactly. But usually you will experience private within some, even if you're fully NHS, which is rare now, you will definitely be doing private. So it makes sense to have that. But I guess when you're going into becoming a doctor or a nurse, or, I guess even psychology, because you can actually go and do a course and then be an aesthetics practitioner with that. Like, you don't know you're going to go into aesthetics when you go into it. Or do you think people do go into medicine now knowing that they want to go into aesthetics?
Well, God, it's been a while. So I don't know. I imagine it's not changed much. I think it's changed a bit in the sense that private has grown a little bit in terms of mainstream medicine as well. And, especially because I was going to go into ophthalmology, like private was going to be part of it, I think, at some point. It becomes a choice for a consultant in ophthalmology. I was like, oh, do you actually want to start a private practice as well? Don't have to, definitely don't have to. But so that kind of stuff was kind of in my mind, but like way down the line, So yes, though it may be kind of there, like when I'm a consultant, I'm fully fledged and blah, blah, blah. Not in the scope that it is now.
Yeah.
Sole practitioner, you're just starting out. Like it's very different.
Yeah. It's so interesting. I guess that will just take time. Like, when they see that, the option is there to go into aesthetic medicine as a field, like it's a real field where actually you can be really successful. You can do all these courses and grow and learn. When that becomes more recognized at the start, because I think that's what it is. I think, I know a lot of young people that are either going into medicine or dentistry, and they're not thinking about in years to come they might be doing aesthetics. Like that just that's not in them. That's not why they're doing it yet. Yeah. Do you see what I mean? Like, I guess if that becomes more common, like that's a whole field in itself, and you can go down it straight away.
But it's like everything else, like a business owner, it's a job. To be a business owner.
Yes.
It's a job, and like with everything, you need training in it. You're just stumbling along and figuring it out, which is what most of us do.
Yeah.
I think we can be better in helping and training people in the best way to do things, or like, you know, these are your options. But at least you know what your options are, and then like figuring it out down the line.
Yeah.
And I'm seeing it. I think training academies are being better at actually adding this as part of it.
Yeah.
And continuity of like, we're always here, so like any questions and all that.
Yes.
But yeah, I think we can do a lot more. Almost like you said, like a day of training on it.
Yeah, absolutely. So where is the aesthetic industry going, and what excites you or worries you about that?
Touched upon it. I think the male demographic is growing. I think especially with like K-beauty, like, because they're huge. Like, I don't know the stats, don't get me wrong, but in like East Asia, Far East Asia, it definitely must be more of an even split than we have here in the West. So I think that's super exciting, because I mean, the male anatomy, not even just the skin, but the male anatomy, like masculine, what society in the West think masculine looks and feminine looks like, you know, that's such a more interesting conversation to have when you start to have more male patients. Because I'm definitely not one to be like, well, this is what we're going to do because this is what the masculine look is. And that a lot of people do, like, this is masculinization. I'm like, okay, this is masculinization. Is that what you want? Because your anatomy is not quite there. And I don't want to like give you a chiseled chin and everything if that's not actually what you want. So I find that really interesting, that conversation to have. So that's really exciting. And then, we talked so much is coming out.
Yeah.
Technology, treatments, products, and it's so unregulated. Because it doesn't have to be. I mean, you come in as a medical device, so you don't need to have the same studies and research behind it to launch then, a drug. And I think understanding that and then being able to educate people on that is really, really important. So it's exciting because we're growing, especially with regenerative type medicines and skin-based treatments. And that's super, super exciting. There's more money and there's more ingenuity behind that research. But caveat is this is all done by private companies, and they are going to sell their product. They're not going to put so much money in something and then it's not as great as they thought or doesn't actually give the result. They will then put marketing behind it. Like, they will try and sell it. You've got to be super careful.
Right. So it's almost like you have to decipher.
Absolutely.
Interesting.
Absolutely. I mean, like, there's no nice guidelines on X treatment. You have to do that research. You have to go back to like your med school days of like, how do I analyze these studies and realize what's a good study and what's not a good study, and realize that actually in a lot of these aesthetic treatments, they won't have huge randomized controlled trial things because they don't need to.
Yeah.
But does that mean I can't use it? No. I mean, it just means you need to be clear with your patients that, okay, there are studies, they're small, they have flaws in them, they're biased because they're run by the actual companies, but they're promising. I've seen really good results myself, but that's the caveat. Right.
Okay. Interesting. And would you need to kind of discover your own protocols, like what works for you and things like that?
Everything.
So interesting.
Everything. Like,
which kind of must be
consent
fun.
forms after. I just spent like 2 days like rewriting all my consent. Like, these are the things that people don't realize that, oh my God, like, it's not just all there for you. If you want to start it yourself, there is a lot of work to do.
And I guess it's fun in the sense of like, it's almost like you discovering what treatments work together and, how to layer it to get the best results. Things
which
like
is great,
that.
which is super exciting. You can come up with your bespoke, packages and things like that. And techniques, which I love. Which we're talking about, like intuition versus intuition has such a big part to play, I think, as well, because it's a creative field. In a sense, which is what I love. Like, it's mixing science with creativity. I mean, there is a beauty aspect of what we're trying to create here. So, and that's subjective. So,
I love
super
that.
Exciting.
Well, no, I'm. It's funny, obviously, as an outsider looking in, I'm always looking at like the latest trends, the latest treatments, and also people's reaction to them is so different. Like, obviously, we know that you're a massive fan of polynucleotides and Profilo, which I've had, courtesy of you.
It looks great.
Someone told me I look younger the other day. I was like, oh, Yes, Profilo's working.
Philo's babe.
But it was interesting because some people will be like, oh, polynucleotides, you know, I like when they do the rating, they'll give it a 5 out of 10, for example. But then you'll hear someone else say, oh, I give it an 8 out of 10, or I'll give it a 9 out of 10. Do you think that's down to how they're using it, or even the product? Like, can it be anything really?
Yes.
Yeah.
Correct. It is because like it's not, Botox has loads of studies behind it, okay, but like polyneucleotides, it doesn't. You know, the studies that we're talking about here, like it's been used in aesthetics since 2005.
It's quite a while, yeah.
It's quite a while. And then PDRN, which is a type of smaller polynucleotides, has been used since the 80s. And that has a lot more trials and stuff behind it. So it's a bit anecdotal in terms of, okay, but then polynucleotides probably provide similar benefits. There are studies, but they're small and they don't follow up for as long as, like I said, like, you know, a drug would. But again, that's not to say that it doesn't work. It just means that the science behind it and the research we have behind it isn't as robust. And that's super important to explain to a patient. Look, I can't promise because I don't know, because there isn't research. I can tell you what I've read, what I've understood from these studies that have been done, and what I've seen in my own practice, that this may help X, concern that you've got. So I think, I can't speak to what these other practitioners are saying, because you're so right. Some people be like, oh, it's a 2, and that will knock so much confidence in people in these treatments, which can be so great and might be the best option for you. I think counselling is so important, that, this may not work, but from what we have available, evidence, historic, anecdotal as well, it could be amazing.
Yeah.
So I think it's based on, treatment, and technique is so important. Polynucleotides needs to be in a specific plane. Though we're now learning that actually potentially you can do it with a cannula and things like this. So we're all learning, and it's all new. Potentially, technique wasn't quite right. They were using it for the wrong indication. If you've got tear trough, polynucleotides aren't going to help you.
Yeah.
So if you're using it for that, then it's not going to be great.
Yeah, because I think that's one of the things, like as a patient or potential patient, you don't hear these conversations. So you might just follow someone and they then poo-poo it, and then you're never going to try it. And like you said, it could be the best treatment for you. And almost like the conversation about, it's down to technique, it's also preference and things like that. Like some practitioners don't use any injectables, they only use devices, and the other way around, like all of that. So it's that bias as well, putting that towards a patient. I think a lot of people don't think about, like I didn't really think about, for example, if someone rates it and you just follow them, you're like, oh, it just makes you think, like, oh, I was going to try that, and now I'm not going to. But actually, do they even do this treatment?
Well, this is why I'm like, question, as a patient, if someone tells you something, be like, okay, but why? Go back to being a student in a way, because you kind of need to. It's quite an unregulated field, and there isn't as much data behind a lot of these new treatments. And
if you think about it as like, it's very different within medicine. Like if there's a treatment that's, tried and tested, well-known, used all the time, let's say, I don't know, like an acne treatment, you probably wouldn't go out as confidently and say it's rubbish, I'd give it a 5 out of 10. Because
you can't.
You can't. Yeah. Exactly. That's what I mean. Because you can, because the way that you described it, like it's kind of promoted by a particular company, or, they're putting their study behind it. That kind of muddies the waters a bit as well, because it's not like a yes, no, like that's the treatment that's been out for years, we prescribe it on the NHS, like you can have an opinion.
I do often think as well, so many opinions of so many treatments, products. I was like, have you actually done in like it at all, or enough of it to make these opinions? Or often some people are like, oh, I don't like that treatment. And they'll be like, but you don't even offer it. You don't offer it because we guess you don't like it, but how do you know you don't like it?
Yeah.
It's interesting.
Yeah, no, it's interesting. And I
take a lot of these things with a pinch of salt.
Exactly. And one of the things that I've found really interesting talking to different practitioners is, like you said, like they go and try loads of different treatments and devices to know if they don't like it, and they will either go for treatment themselves, test the result that way, or they'll just go to conferences and courses, and like then they'll make their judgment. But some people don't even do that. They just decide they don't like it, and then you follow them on Instagram and you think, well, I'm not going to try it now. And
but it is different. I think like mainstream medicine, like these treatment, when they come through the NHS, like it's taken so much robust sort of clinical trials and stuff, and we really don't have that with a lot of these new treatments. But it just, you have to go back to like, it doesn't mean it doesn't work. It just means that there's not a huge amount of evidence there. It doesn't mean we're bad, but like, you just, as long as you counsel people on that,
Yeah.
then yeah, you know, it can have great benefits.
Yeah. So jumping back to your business and running a clinic yourself, what was the one thing that you didn't expect when stepping into entrepreneurship?
Yes. Yeah.
Just yes.
That, yeah, correct.
Entrepreneurship.
Nail on the head.
Thank you.
That, yeah, like it is a new job. Like your business is your baby. I have a child. News. Yeah, it's a lot. It's all encompassing. And what was the question? What was I not expecting?
Yeah, what did you not expect?
Yeah, it's all encompassing.
Yeah.
And you will spend a lot of time, and it's no longer that time equals money situation, and that can be quite mentally difficult to get across because you don't see the rewards straight away.
Yeah.
And that is like trying to push my mentality to be like, okay, this, you know, I spent 2 days rewriting everything, but that's going to be beneficial in the long term. You don't just see that immediately back. Completely changing my mentality on work and financial benefit.
Yeah. It's true,
actually.
actually.
A lot.
Yeah, because obviously we work a lot together, and you put in hours outside of hours, just, you know, reading things, digesting things that are going to obviously benefit you in terms of promoting a service or introducing a new service or yourself. And it's like so much work goes into that part that people forget, right? They think turn up, do the treatment, go home. But no, you've got to like do the whole shebang.
Yeah, and like hopefully, where's the wood? No, you know, complications are far and few in my career, but they will happen. And I need to make sure that the guidance is there. My training is there. Like something that might happen in 4 years, I need to know how to treat it and make sure I'm up to date. I need to make sure my guidance is there. I need to make sure I have that, you know, product in stock to help. I need to make sure my aftercare is there. Like all that training for something that might happen 4 or 5 years down the line, but it's so important. And like shifting your mentality to that is a huge, like, it's just so different. It is just so, I can't emphasize it enough. It is so different to be a business owner.
Yeah.
Than to work for someone.
I'm glad you are emphasizing it, because I think that's the bit that people don't think about.
Yeah.
That's the hardest part. Like that
you
shift. See
people, and Instagram, it's fake. You see people like flourishing and further down the line, and it's so easy to compare yourself to these people like they're flourishing and they're doing so well. So yeah, but it's taken time. It's been a journey for them.
Yeah.
And enjoy the journey as well, because otherwise you'll get lost.
For sure.
Stop focusing on the future. Just focus on the now. Enjoy the process, because otherwise you won't get through it.
Yeah.
Frankly.
Absolutely. How do you stay consistent, like emotionally and
therapy?
Love.
To be fair, yeah, like rebalancing like work life, because I am someone who I won't stop once I'm into it. Classic. So like having a balance and being rigid with that balance, and also having someone to be accountable, being like, no, you said you were going to have this evening off. You said you're going to have this weekend off, because it never ends. It never ends. So making sure that you take your breaks, all those like, yeah, CBT type things, you know, make sure you're keeping a balance in your life, making sure you're exercising, eating healthily, you know, going for a walk, getting some sunlight, like, you know, with SPF. Making sure you have a balance, because I think initially as well, I was so all-encompassing and absorbed by it, and then you lose yourself in it. You need to take a step back.
Yeah.
Especially when you start out, it's you, like you are the brand. Like, okay, you need to protect yourself then.
True.
And you feel a bit guilty, because it's almost like, I can only compare it to like when you're revising for an exam, because you can never cover everything. And so it's a bit like that. You can never do everything, but you can do your best.
Yeah.
And often 80% will be enough, and you move on. That's my new thing as well. Like, I won't get to 100%. I'll get to 80% and I'll move on. Because otherwise I'll keep changing 100%. It will never happen. So that is, I'm learning loads, but balance, keeping my good like mental health things there, looking after myself, taking breaks.
Good.
Taking rest days. It's super important.
Yeah, 100%. I think for business owners, you've got to recharge. You've got to look after yourself. It's so easy to kind of get, yourself, ironically, even if you are the business. And like you mentioned brand, like you are your brand as well, which must be even harder because it's like you're kind of everything at the moment.
Yeah.
Is that harder to switch off?
Yeah.
Yeah.
Looking for a PA. Send submissions. No. Yeah. It is hard. It is hard, and it's easier said than done as well. But what's the question?
Well, no, a question on that. As your team grows, do you think you will still be as focused on you as the brand, or do you think you'll start like trying to let go and sort of push people forward to be?
I think that's what really excites me about leadership and business ownership. And I've not run a business before, but I was like vice president of the medical students union and things. So I've been in those and like a director of my drama society at med school. So like I've had those leadership roles, and that is such an important part of it. And it's how you thrive, is like promoting other people to take on responsibilities. Don't get me wrong, I'm a micromanager, as you might know. But that is how it's going to flourish in the future. It's find great people, nurture them, get them to make their own decisions and let them do that. So that's definitely, the plan. Yeah.
And I can see you already coming up with your own protocols and methods and things that will become like you. Like you'll always be there, if that makes sense. Because you're like that with your content. You're like always there. Even if I'm working on something, like I kind of now starting to get like, oh, okay, I see there's a pattern, there's a theme. And I can imagine that'll be the same when you are running.
The general, like the vibe, the vision will always be there. Will it be my inside scoop? Will it be my name? But probably not. I see a time where that changes.
Interesting.
And I think it will need to. Yeah.
Yeah. And that's all, I guess, like people make that conscious choice, like name the clinic after me, pros of that, cons of that as well. Like there are clear pros and cons of naming a clinic after you, but then also at the same time, same with like if you become a brand, like it still is you, right? Even if it has a different name.
Yeah. It's also just honest. Like it is me.
Yeah. Obviously.
This is me. Yeah. So yeah.
Love that. Amazing. So going on to patients, what does good patient care look like to you? What's like really important to you?
Honesty. Yeah. I think it's kind of what we were just all talking about. Being honest. And it's hard to find that balance with being like a salesy, and trying to, make sure that the treatment does happen. But being honest, because there's nothing worse than over-promising something and then people aren't happy or satisfied, and it wasn't what they thought. As you know, being a patient, I almost undersell.
Yeah.
I almost over-say about downtime, almost undersell on the benefits so that you're pleasantly surprised. Because, things could take X time to resolve and things may not work. And I think as long as you're honest about that, you won't get complaints. And I think that's really important. I think I see it a lot. People oversell, overpromise these things. And I'm just like, well, that's just not true. So I think that's fundamental to good patient care is honesty.
And you're very much skin first. That's your thing, isn't it? So do you ever get people coming in asking for something that's like a quick fix and you're like, no, well, your skin integrity is not there. Like that's what...
Yeah, we live in a society of like quick fixes, and I'm very much like, let's bring it back. In reality, if you want to get to X, it's going to take time. And it's like, when I prescribe a skin cream, I'm like, this isn't an overnight thing. In reality, this is probably going to be a year of you continuously using it to see the great benefits. And once you do that, people are like, oh, great. And then you'll also often get a message like 6 weeks being like, oh, it's great. I'm like, yeah, it is. And there's more to come. But if you say, oh, yeah, in 2 weeks, you'll look great. I'm like, well, no, because then they won't. And then they'll stop using it. So that's, what were you saying? What was the question?
No, you answered my question perfectly.
Gone off again.
No, you literally answered exactly what I was, asking about. So do you think patients can sense when they're being sold to, and is that why you avoid it? Yeah,
definitely. Yeah. So that's why I just like, I'm educated. Like I'm here. You've come here for consultation, which is why I charge for consultations. It's my time and education and expertise that you're coming for, not the end treatment. That's a consultation is protected time to talk, to establish what you've come in for, what your concerns are, what your expectations are, and for me to provide you with as much education as I can in the best way. That's the consultation.
Yeah.
The treatment is it might happen, it might not happen, and that's totally fine.
Yeah.
So I'm sticking to that, and it tends to work.
No, absolutely.
I think it's just honest. It's, you know, like genuinely the money side isn't there. Like, I'm genuinely here to try and do my best for you, and these are the options for that.
Absolutely.
Obviously, money has a part to play. People have a budget, but that comes later. You obviously come here for something.
Yeah.
So
do you always start concern what they're here for and then budget? Is that like the last thing you'll talk about?
it won't be the last thing. It will start to come in towards the end. Obviously, that's something there that we need to talk about. And then there'll be options. Like, okay, you know, this is probably the best. It may be the most expensive option. It may not be, actually. And that's where it sort of comes in.
Nice.
Yeah.
Like that. So how would you say you build trust, especially with new patients? What have you got any like levers to building trust, or is it just education?
It's education and honesty, to be honest. I think, like I said, I go into, I'm not trying to bore people, but I try to go into the science and what we know, and, you know, honestly be like, well, you know, there isn't a huge amount of data on this, but I've seen great results. I think people buy into that and trust that, because it's just the truth. I think you can't really go wrong if you're telling people like the honest truth.
Yeah.
I think you go wrong when you oversell things.
Yeah.
So yeah.
Oversell outcomes, I guess, is a whole thing, isn't
Yeah,
it?
like this will be this, like certain things we know, like Botox, maximum effect 2 weeks. We know that, but like, you know, things like regenerative treatments, they're going to take longer. So being honest about that, you're not going to see things in 2 weeks with this. You might start to see things between treatment 2 and 3. But in reality, it's going to be, you know, a few months later when we're stimulating things and you start to see that coming into your skin. So I'm just super, super honest.
Love that. Yeah, you are very
End of the
honest.
day.
Yeah, honesty is the best policy. But honesty is linked to trust, isn't it? And trust is the fundamental to, I think, having a lifelong patient. Like they've got to trust you. Like when you introduce a new treatment, they're not going to go to a competitor because they trust you. So we touched on ophthalmology, and you talked about that was a passion of yours. So how does your microsurgical interest and training, I guess, sort of go into your aesthetics approach? Do you use that, do you think?
Absolutely. Yeah, I think people underestimate how technically challenging aesthetics can be. We are talking about thin layers of your anatomy and trying to get products into those exact layers, and, you know, filler especially, it's an art, and it's not just putting it in there. This is where it scares me that people do a one-day course. Non-medical people do a one-day course and then they're supposed to, no thank you. And this is why I advocate for more and more training, because I still don't, I think even if you're medically trained, I still think a one-day course, you're not going to be the best. You need more training, you need more practice and supervised practice, I think. So yeah, it's very technically challenging, and I love it because I missed that when I left the NHS. Like ophthalmology, what I loved about it was the surgical side, the microsurgical, the technical skills of it. So when I refound that in aesthetics, I loved it. You know, again, being so precise on our anatomy knowledge, and then where you're placing the product, where you're injecting. I love it.
Yeah.
I love it. So yeah, it's definitely helped me.
Love that. And I guess, do you think aesthetics lacks technical praise? Do you think that people aren't as appreciative of that?
Yeah, I mean, I don't think people go into it to be like, oh my God, you're an aesthetic. Like you're a neurosurgeon. Like, don't get me wrong, it's not like that. But I think to get great outcomes, it's practice, it's training, it's refining, and it's technical skill. Yeah.
Something that someone said, and I'm not going to say it exactly right on the podcast, they said that we only talk about bad results in aesthetics because you see them, but it's good results that you don't see.
Yeah, so true. So true. And because you see the results, right? It's not internal surgery. You see the results. So yeah, the bad ones get a lot of flack. And it's also, talking about new treatments, new skincare. You get one influencer saying that, oh, this skincare didn't work for me. Like, retinoids didn't work for me. Well, yeah, because you used them wrong and you kept using them when you were getting a reaction. Like, it's but that whole, product, that great product, gets a bad rep. So yeah, what were we talking about?
You said it right. So what technique?
ADHD is flowing.
No,
today.
same. What techniques are you currently obsessed with perfecting? Is there something new? Because I know we were talking
Technical
about
skills.
Yeah,
sorry.
technical skills. Yeah. So is there a new technique that you're like trialing more and more, or something that you want to try that you've seen?
Cannula. Love it. So cannula, like if you don't know, so like needles are needles. Cannula is like a longer but blunt at the end. And so it's safer in terms of like filler and vascular occlusions. But it also just means that you can spread product a bit better. Even using it for polynucleotides now, like it means the downtime's a bit less. But there's technical skills for that. For example, polynucleotides, you need to be as superficial as you can. You can't obviously be intradermal with a cannula, but you need to be as superficial as possible. So there's the technical skills of that. But I'm loving it, and I'm trying to use it as much as I can because it's safer. I think you get better results. But there's a place for it. You can't do it everywhere.
Yeah.
So learning that and exploring that is great. I love it.
I've been seeing more people doing it for lip filler, and you can see a difference. It's really interesting.
Almost exclusively use cannula for lip filler.
Love.
Yeah, except for the border. Volumization of the actual main body of the lip. Yeah, pretty much only use cannula these days.
Interesting. No, it's good, and I think that's what people will kind of learn from other practitioners as well. I guess that's where the community of like sharing techniques and protocols comes in, right? Like the more things that you learn. I've started doing, obviously you're not going to put it on social media, I'm sure, but within your sort of network, talking about different techniques, is that how you learn new things as well, through sort of colleagues? And
yeah, absolutely. Yeah.
I love that.
Yeah.
So there's a whole community we don't even know about.
Yeah.
Cool. Well, we have covered so much, but one thing we haven't covered yet, and I'm sure it's the bit that you're like, I don't have a story for, but you're going to tell me a story anyway, is our confessional. So we always ask, because I think particularly as medical professionals, people don't think that you have the most interesting experiences, but I'm sure you do. And things that are kind of out of the norm that happen in your day-to-day practice. So my question is, can you tell us an outrageous or interesting or a story that kind of stuck with you from a patient experience?
Honestly, I clearly have nice, normal patients in aesthetics because I don't have anything crazy. At least that I can say on camera. I have loads of the NHS though.
Go on, give us one.
Plenty. Many I can't say on camera again.
Fair.
Just wild things. People are interesting.
People are crazy, yeah.
I had one A&E back in the day. Gave a patient a urine sample. I didn't know what was going through their head. They clearly weren't happy. But yeah, I gave them a pot to do their urine sample in. Came back. Clearly wasn't a me issue because, I don't know, he came back but then poured it on a computer.
What?
On the other side. And that was that. And I was like, that was a choice.
He did a urine sample.
Did a urine sample.
And then he poured it on a computer.
Yeah.
For no reason.
Not that I could tell.
What did you do? How did you even react to that?
Kind of pretended it wasn't my patient. No, joking. God, I think I just went back and I was like, okay. So do you need another pot? Best part of it, that computer was not fixed for about a month. Talk about NHS efficiency. That computer was not fixed. Well, yeah, it was gone. That was a choice. There's a lot of poo and wee stories in the NHS.
Oh, lovely.
Yeah, I think people walk through that door and then they just forget.
Yeah, strange, isn't it?
Some decorum.
Yeah.
Yeah.
I've heard that people act so differently in a hospital, like things that you would just never see, never do. They just do.
Yeah, I guess they're ill. I mean, cut them some slack. But
fair enough.
That was a weird one.
That is mad. And thank God it was not your computer. Can you imagine if that, I mean, obviously, let's hope that would never happen in your own practice now, because that would be your personal computer as well.
That would be my lovely iPad.
That would be tragic.
No thanks. Please not. No urine samples here.
Cool, we'll keep those out. I love that. That was a good story, actually.
My mind is filling all these stories now.
Do you want to share another one?
Well, like the after episode.
Yeah, between you and I, the ones that you can't say
exactly.
on camera. Yeah, can't
Oh my
wait.
God.
So yeah, obviously we've heard so much about you, but tell us like where we can find you and what's next. Like, have you got anything exciting coming up?
Oh my God. Where can you find me? I am in Soho out until, which I love. So come find me there. On the Insta web. Oh God, I'm such a millennial. Gen Z is cringing everywhere. I'm on Instagram at Dr. Nabil Jetha. So if you want to see some of the stuff I do, how I approach treatments and general holistic approach that I like to adopt, please look at that. And yeah, I mean, we kind of touched on it, but packages may be working their way into the clinic soon. So stay tuned.
Exciting. Well, thank you so much for coming on. We obviously have one last question we have to ask everyone.
Yes.
There is one more.
One more.
Is the patient always right?
No, not always. But also, that's why they're coming to you.
Yeah.
Why would they? I mean, if they knew exactly what they want, then there would be no real point. Just get some robots in. No, I think, and that's fine. You know, they're not always right. And that's why they've come to you, to learn and hopefully educate themselves. And you can hopefully reframe that actually maybe that might not be what you require for your concern.
Absolutely. Yeah. I agree.
Sorry.
Yeah, I mean, I always try and stay impartial, but yeah, I agree. It's hard.
Try and stay impartial, but yeah, no.
You're right.
Not always, no.
Good, fair. Okay, well, thank you so much for coming on. It's genuinely been a pleasure. We'll have to have you on again, I'm sure. I'm sure you'll have more to tell us, more exciting news. But yeah, thank you.
Thank you so much.
Love hearing the real stories behind the aesthetics, medical and dental industries? Make sure you follow us on Instagram and TikTok at The Patient Is Always Right for exclusive content. You can listen on Spotify, Apple Podcasts, or wherever you get your podcasts. And don't forget to watch the full episodes on YouTube. Hit follow, subscribe, and stay tuned.